The holidays can be a triggering and uncomfortable time for those battling addiction or mental health issues.
I spoke with the Chief Medical Officer at Gateway Foundation, Dr. Ruween Rafian, who shares how people can cope with the pressures that come with the holiday season.
Holidays, I think we all agree, are stressful. Even though it's a nice time of year, we are looking forward to it, to spend time with our families, with our friends, with our colleagues, maybe take a little time off of work and relax. Holidays become stressful due to increasing demand on our time schedule. Now, if you want to add issues that one may have, such as depression, anxiety, addiction, it gets compounded as of how to deal with this upcoming event. Many times during the holidays, we get together with family. Well, disease of addiction has a significant impact on our relationship with family members. Many times some of those bonds may have been damaged. So a patient, a person who is dealing with addiction, when facing the time that now they have to go and see the family members that maybe they have hurt in the past due to their addiction, that adds a very difficult process emotionally to them. So how to participate in family events, knowing that guilt and shame that is carried with the past behavior or even current behavior if they're not in treatment, if they've never been in treatment. As a result, holidays can become very stressful and can be triggering for many patients with addiction.
I mean, I think the holidays are just hard for everybody all around, so I can't imagine if you are, suffering from a top mental health issue in the country right now. You mentioned anxiety and depression. Is that kind of the predominant issues facing mental health in America?
It is, especially after the pandemic we've faced and the isolation we've had, challenges we've had. The incidence of depression and anxiety have increased significantly. Incidence of anxiety are up tenfold. Incidence of major depression are up fivefold. So there's quite a bit of struggle. Now, once you add addiction to this, it gets even worse.
Now, for people that are around folks with addiction, for loved ones, what can we look out for? What are some signs?
Signs, multiple signs. Any change in routine behavior, any behavioral changes that one may notice. Absenteeism, when the family members fail to show up to planned events. Their behavior during those events is not their usual norm. Some changes in their demeanor, anger, agitation, isolation, not responding to outreach, or just simple noticing that maybe they are drinking a little bit more than what they used to. As a result, the behavior is affected by that. Some of these are some of the signs to watch for, that maybe the family member is in trouble.
I mean, I know that Gateway shows that there's hope for folks that are facing mental health issues and disorders and dealing with addiction. What are some of the treatments that are out there?
So we at Gateway Foundation offer a number of treatment programs, residential treatment programs, outpatient treatment programs, partial hospital treatment program, intensive outpatient treatment programs, and many of our programs are a comprehensive approach of medication, therapies, individual therapies, family therapies, and the therapies are a variety of the therapies that are used in addiction medicine these days, including cognitive behavioral therapy, dialectical behavioral therapy, or interpersonal therapy. So we curtail the treatment according to patients' needs. We have a number of centers all over Illinois. We'll be happy to help patients who are willing to come in for treatment.
If you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. Their information is on your screen.